There was a clear explanation of the purpose of the study. The purpose of the study was to see if nurses were knowledgeable and were using the Brady scale correctly with the elderly in their daily care practice, saying that the Brady scale is very important in the prevention of pressure injuries.
Was the population of interest adequately described? Yes, the population consisted of several nurses from several different units, including the emergency, clinical, surgical, hospitalizational units, nephrology, radiotherapy, central, and cardiotherapy centers of the hospital. Was the sample broad enough to capture all facets of the phenomenon? Yes. Were the limitations of the sample clearly justified? Yes. Were the limitations of the study or the sample clearly justified? Yes. Nurses were included if they were in the research sector for at least 6 months from different shifts, morning, afternoon, and evening, and those who voluntarily accepted to participate. Nurses were excluded from the sample if they were either on vacation or removed by health license or at the company less than 6 months.
Were the data collected appropriately? Was the method of data collection adequately described and justified? Yes, the method of data selection was described as descriptive exploratory research with a qualitative approach. The purpose was to see if nurses had the knowledge to make the correct use of the Braden scale with their elderly patients during their daily care practice. Were the methods used in a systematic and organized manner? Yes, the data was systematically gathered by performing semi-structured guided interviews that were captured via audio, and then they were translated, and the data was clustered, and after that, it was analyzed. Were data gathered through 2 or more methods to achieve triangulation? The data was gathered one way only, by performing semi-structured and guided interviews with 14 nurses. Was the phenomena studied in multiple contexts or in settings? The data was gathered and it was studied in many settings, multiple settings. It was studied in the emergency, clinical setting, as well as the surgical hospitalization units. Also, nephrology, radiotherapy, and the Center and Cardiology Therapy Center. Were the data analyzed appropriately? Is there a clear description indicating a systematic form of data analysis? Information was grouped into data clusters after reading them 2 times. Data was then translated through content analysis with a focus on thematic analysis. Does the data study report what was done, how, and by whom? The data was systematically gathered by performing semi-structured interviews. The 14 nurses were remaining anonymous, and they were each given a flower name. They participated in this semi-structured interview. The interview lead with guiding questions was then recorded into an audio system. Were the data analyzed appropriately? Continued. Was there more than one researcher analyzing the data? And if so, was there a clear indication of how differences between analysis were addressed? Data systematically gathered by performing semi-structured interviews with 14 nurses who participated in a semi-structured interview with guiding questions that were recorded into an audio system was the system that was used. The number of researchers was not addressed in the data. Did the analytics procedures suggest the possibility of biases? All 14 participating nurses were kept completely anonymous. They were selected from different environments and from different shifts. Nurses who had not worked in at least 6 months and 7 nurses in all were excluded because they were either on vacation or had removed or not kept up with their health.
My question was, does the study discuss how its result advanced the understanding of situations that are relevant to multiple settings? And the study did, especially when it mentioned the different clinical settings it can be related to, especially like emergency, clinical, and surgical hospitalizations. But it did mention that in elderly patients in the outpatient setting were not considered in the study. And it also mentioned how nurses on different shifts, morning, noon, and night shifts, were asked to participate in the study. Next question, does the study contribute any meaningful evidence that can be used in nursing practice or that is useful to the nursing discipline? Yes, it does, especially when we use the Braden scale as a whole, because it is a useful tool that applies to the perfect population of elderly adults in the hospital. The only thing that the study pointed out is that there's a lack of time and staff members to utilize the Braden scale. And then, since that is the reality, attitude towards patients acquiring pressure ulcers are that it's something to be expected, so they don't actually try to help the situation. My question was, does the study discuss how the results advance understandings of situations that are relevant to multiple settings? And yes, it did discuss the populations of interest were a part of the emergency, clinical, and surgical hospitalizations. The reason why it didn't include the outpatient elderly clients is because they felt that it wasn't applicable to that setting, that they wouldn't get the pressure ulcers as easily, and there were different shifts involved with the nurses, so they felt like it was fair to say that it came from different times of the day, nurses working at different times. Does the study contribute to any meaningful evidence that can be used in the nursing practice or that is useful to the nursing discipline? Yes, the study does point out that the Braden scale is a free tool that is available for any nurse to assess a patient's risk for skin breakdown. And it provides a good way to plan care. They just say that there's not enough time to actually do that assessment and plan the care and implement it. It's almost an expected thing, pressure ulcers, to happen in the clinical setting.